In this video we will discuss basics of electrical activity of heart in brief. Important limb leads for identification of axis. Explanation of why there is axis deviation. Methods and practical approach for determination of axis. Cardiac axis is the net direction of electrical activity during ventricular depolarization. In healthy heart, the net movement is downward and slightly left. The heart's vertical axis is determined practically using 3 unipolar and 3 bipolar ECG leads, while the horizontal axis is calculated using chest leads. 3 bipolar leads are limb lead 1, 2, and 3. Unipolar limb leads are AVR, AVL, and AVF. This diagram showing directions of limb leads. This is normal limb lead and augmented limb lead placement. The 3 standard limb leads forms an equilateral triangle called Einthoven's equilateral triangle. Each angle of triangle being 60 degree, it's also called triaxial reference system. The unipolar extremity leads are so constructed that their lead axis geometrically bisect the angle of the equilateral triangle formed by standard limb leads. Each electrode of these augmented limb lead is a positive electrode. These augmented leads also form triaxial reference system. When these two triaxial reference systems are combined and superimposed upon each other, they form hexaxial reference system. This hexaxial reference system we will use for axis determination. Electrical axis classification. There are 5 main electrical axes. The normal axis is between -30 degrees and 90 degrees. The left axis deviation is between -30 degrees and -90 degrees. Right axis deviation is between 90 degrees and 180 degrees. Extreme axis deviation between -90 degrees and 180 degrees. And indeterminate axis, the QRS complex is isoelectric or equiphasic in all leads with no dominant QRS deflection. In this diagram, you can see all electrical axes. Before going into details of axis deviation, revise few general concepts. Cardiac axis, it is general direction of electrical current passing through the heart. Normal electrical activity starts at SA node, then goes to AV node, bundle of His, and from bundle of His to the left and right bundle branch. The normal electrical axis of heart is passing from right side of heart to left side. Abnormalities of axis deviation include right axis deviation and left axis deviation. Now we will try to see what exactly happened in right axis deviation. As we already seen in previous image, that normal electrical axis was moving from right atrium and entering into the left ventricle. But in case of right axis deviation, the average direction of electrical activity will be towards the right ventricle. Right axis deviation commonly seen in right ventricular hypertrophy and left ventricular infarction. How will you explain this? In case of right ventricular hypertrophy, the wall of right ventricle is hypertrophied, so majority of electrical vector will passing towards right side, so in right ventricular hypertrophy, the average electrical activity will pass towards right ventricle and that will result in right axis deviation. Similarly, in left ventricular infarction, the left ventricle is dead. Therefore, majority of electrical activity will pass towards the right side. So, that also results in right axis deviation. Left axis deviation. Common cause is left ventricular hypertrophy. Due to left ventricular hypertrophy, the average direction of electrical activity is mainly towards the left ventricular wall. So, electrical axis will move towards the left side, that is left axis deviation. Different methods used for axis determination. Quadrant approach, 3-lead analysis method and isoelectric lead method. Out of all these methods, we are only going to discuss the quadrant method. Practically it's easy to determine the axis by this method, and our aim is to use this knowledge in day-to-day practice. Before that, if you really like the video, please subscribe, like and hit the bell button to get regular notifications. Quadrant Method. Remember, electricity going towards a lead causes positive deflection. Electricity going away from the lead causes negative deflection on ECG. To determine the axis, we must check QRS deflection in lead 1 and lead AVF. Here you can see, in first ECG picture QRS complex, the R wave deflection is predominantly positive. Similarly, in second ECG picture QRS complex, the S wave is predominantly negative. And in last picture QRS complex, the R wave and S wave is almost equal. It's called as equiphasic QRS deflection. For quadrant approach, we use hexaxial reference system. It is made up of unipolar limb lead and augmented limb lead. We called it as triaxial reference system. When these two triaxial reference systems are combined and superimposed upon each other, they form hexaaxial reference system. The most efficient way to estimate axis is to look at lead 1 and lead AVF. Examine the QRS complex in each lead and determine if it is positive, isoelectric or negative. If lead 1 is mostly positive, the axis must lie in the right half of the coordinate system. If lead AVF is mostly positive, the axis must lie in the bottom half of the coordinate system. Combining the two plots, we see that the axis must lie in the bottom right-hand quadrant. So if lead 1 and AVF are both positive, the axis is between 0 degrees and 90 degrees, that is normal axis. According to above method, we can determine axis. We have already seen, if QRS positive both in lead 1 and AVF, axis is normal. Now we will see other possibilities. If the QRS complex is positive in lead 1 and negative in lead AVF, the axis is between 0 degrees and minus 90 degrees, that is left axis deviation. If the QRS complex is negative in lead 1 and positive in lead AVF, the axis is between 90 degrees and 180 degrees, that is right axis deviation. If the QRS complex is negative in lead 1 and also negative in lead AVF, the axis lies between minus 90 degrees and 180 degrees. This is called as extreme axis deviation. Just to summarize it, if QRS complex is positive in both lead 1 and lead AVF, it is normal axis. If QRS complex positive in lead 1 and negative in lead AVF, it is left axis deviation. If QRS complex negative in lead 1 and positive in lead AVF, it is right axis deviation, and if QRS complex is negative in both lead 1 and lead AVF, it is extreme axis deviation. Easiest way to remember it, check lead 1 and lead AVF. If both are positive, it's normal axis deviation. Both lead 1 and lead AVF, QRS complex negative, it's indeterminate or extreme axis deviation. Now for right axis division, remember mnemonic, right reaches. In this picture you can see, if we kept lead AVF exactly under lead 1, it looks like that both QRS complex are approaching or reaching each other. That's why we can remember it as right reaches. In left axis deviation, lead 1 QRS is positive and lead AVF QRS is negative. Remember mnemonic, left leaves. If we keep lead AVF just below lead 1, if QRS deflection is going away from each other or leaving each other, it's left axis deviation. We can remember it as left leaves. That is, in left axis deviation, QRS axis in lead 1 and lead AVF leaves each other. This picture shows all-axis deviation with QRS deflection in lead 1 and lead AVF. Now at the end, we will go through common causes of axis deviation. Causes of left axis deviation includes left ventricular hypertrophy, left anterior fascicular block, inferior myocardial infarction, Wolff-Parkinson-White or WPW syndrome, and ventricular tachycardia. Causes of right axis deviation includes right ventricular hypertrophy, left posterior fascicular block, lateral myocardial infarction, WPW syndrome and dextrocardia. Causes of extreme right axis deviation. Uncommon due to clinical cause, mostly due to misplacement of ECG electrodes. If it is present, first check limb electrode placement. If electrode placement is right, then possible causes includes ventricular tachycardia with extreme axis shift and ventricular pacing. That's all about axis determination. Thanks for watching. Do not forget to subscribe the channel.